안녕하세요. 마스터 코스를 진행하고 있는 K치과 강춘규 원장입니다.
Greetings. I'm Dr. Kang Chun-gyu, K Dental Office, a lecturer in the master course. Today, I'm going to talk about implant maintenance. Even though an implant is ideally positioned with ideal prosthesis, if maintenance is not provided appropriately, the implant will inevitably fail. Thus, maintenance of implants is of utmost importance. Contents of today's talk: importance of maintenance, followed by regular checkup timing and checkup items, which includes implant success factors and recall timing of regular checkups and checklist of regular checkups. Number 3, maintenance by experts. Number 4, maintenance by patients. Due to lack of time, I will not go over number 3 and 4. First, importance of maintenance. As you know, compared to natural teeth, implants have less surrounding vessels, and it has less effective tissue barriers, and it has no periodontal ligament, which all add up to biological disadvantage. Therefore, it has low resistance to foreign objects, and when infected, it doesn't heal very well. Under poor maintenance, it can easily develop periimplantitis, which can be addressed with non-surgical or surgical treatment. However, good regular maintenance and strict oral hygiene is required for successful implant treatment. To maintain implants, we need to consider the following factors: intraoral bacteria and excessive loading on implants, and appropriate amount of keratinized tissue, gingiva, is required, and there is a host factor. Among the factors, let's look at intraoral bacteria that can be controlled. Excessive load on the implants can also be controlled using the regular checkups. As I said before, between implants and natural teeth, when we consider bacteria in the periodontal pockets, implant is in a much more disadvantageous position. But after implant surgery, we need to maintain a stringent oral control to maintain health around the implants, which will eventually lead to the successful implant treatment. Now, let's look at regular checkup timing and checkup items first. The success factors of implants: we need to have no inflammation around the implants, and there should be no pain or discomfort on the part of patients, and there should not be any radiological translucency around the implant, and there should not be any clinical mobility, which means implant failure. After the delivery of superstructure, the bone resorption should be 1 millimeter or less in the first year, and no bone loss after that. This is the picture taken after implant placement and prosthesis. 7 years post-op, and marginal bone loss is not occurring, and clinically, even the keratinized tissue is not abundant. There's no inflammation in the gingiva, so the periodontal tissues look healthy. So when these are stable, the implant treatment can be said to be successful. Regular checkup recall time. For long-term implant success, regular checkup is needed to early diagnose and control the complications due to infection and excessive loading. The necessity and the intervals of regular checkups should be discussed with the patient when implant consultation is provided, and more details should be provided at the time when the treatment is finished. Patients with periodontal inflammation, smokers, or attritions due to bad habit have a higher possibility of complications compared to others, so more stringent control and regular checkups need to be explained to the patients. If you look at the timing of implant to regular checkup recalls, in 4 weeks after the delivery of prosthesis, we need to check the discomfort and also oral hygiene. After that, 3 months later, a regular checkup should be conducted to check superstructure and oral hygiene. If oral hygiene is not very good, another regular checkup in 3 months. If it is good, the next checkup is in 6 months. Depending on the compliance of patients and the clinical symptoms, the intervals of regular checkups can be adjusted. Clinical symptoms include bleeding, unprobing, gingival swelling, plaque, and calculus deposition. In terms of clinical symptoms, after the delivery of prosthesis at about 4 weeks, we need to check the pain and discomfort. If there are such discomfort or pain, we need to check gingiva to check whether there is any remaining residual cement, and we need also check excessive occlusion. If there is any mobility, we need to check screw loosening. So at 4 weeks after the delivery of prosthesis, we need to check these when symptoms are there, and a regular checkup should be done in 3 months. If there's no symptoms at 4 weeks after the delivery, then the regular checkup can be done in 3 months. At 3 months, we need to check pain and discomfort again, and if there's implant mobility, we can take x-rays if necessary. We can also check implant fracture. Also, plaque control needs to be checked. If it is not properly done, retraining should be provided for proper plaque control. And we need to look at superstructure to see whether there's any contact loosening or under occlusion, and sink down. And mobility should be checked to see if there is any screw loosening. After that, when oral hygiene is not very good, every 3 months the checkup should be done, otherwise every 6 months. After the delivery implants, we need to explain what they need to be careful about. The longevity of implant depends on the cooperation and efforts of patients. We need to explain to the patients continuous oral hygiene and control is very important. You need to advise them not to chew hard or tough food with the implant area. Improper chewing after the delivery of prosthesis, or there's a pain in the opposing tooth from implants, and especially when implant is placed in the most posterior region, tongue or cheek can be bitten. Wound infection, poor pronunciation, these are normal symptoms in early stage. Over time, they can adjust to those. You need to tell them about this. Like natural teeth, plaque control is important to maintain implants. That's what you need to explain to your patients. After the delivery of prosthesis, they need to understand when they come to the dental office. First, when there is mobility in the implant prosthesis, I believe this requires the patient to come to the clinic immediately. And if there is a smelling around the implant, that should be checked by a dentist. And if there is a strange feeling or pain during chewing, requires dental office visit. And if there's a prosthetic fracture or food impaction, which is one of the biggest discomforts, they need to visit the dental office. Or continuous biting on their tongue or cheek, that requires dentist adjustment. As you can see, after the setting, the cheek is frequently bitten because the patient didn't have a prosthesis for a long time and the surrounding tissues are not adapted properly yet. Compared to a natural tooth, this is not very natural, causing this cheek biting. So, using a diamond point, the line angle can be rounded like this. So, adjustment can be required when biting on cheek or tongue occurs. Next, the checklist. What needs to be checked during regular checkup? First, pain, oral hygiene, environment, mobility, probing on the gingiva, a bleeding index, the condition of keratinized tissue, and if necessary, X-ray assessment is required. A patient comes and complains pain during chewing. It may mean the failure of implants, screw loosening, or soft tissue inflammation. And a patient says the opposing tooth has pain. It is because the opposing teeth didn't have any pressure from chewing due to the missing teeth, and as chewing began to apply pressure on the opposing teeth, the pain is temporary for about a month and will go away naturally, so that should be explained to the patient. For about a month, the patient should be advised not to chew hard or tough food. They need to be on soft diet, and you also need to check excessive occlusal load. This patient complained pain and mobility during chewing, and X-ray was taken. It shows the implant was fractured, causing mobility and pain during chewing. The reason for that is that a very thin implant was placed in the premolar area, causing the fracture of the implant. And during chewing, they can feel pain due to food impaction. Natural teeth can move immediately while implants do not move, so implants would have gap like this where food impaction can occur. So we need to make adjustment to prevent that. And patient can complain surrounding gingiva is painful. And then we need to check screw loosening and inflammation in the surrounding soft tissue. Next, plaque control should be checked. Stringent oral hygiene control should be provided through training to maintain healthy tissue around the implants. For plaque control, patient may complain bad breath, not only the surrounding area of implants, but poor plaque control can cause the smell. So plaque control is important, and we need to train the patients on the importance of oral hygiene. Oral hygiene is good, but odor can come from implant. It may be because of the cotton in the screw hole, especially when you did not place the implant yourself. The cotton absorbs saliva and the bacteria can proliferate on it, causing the odor. So you need to look into the hole to check if there is cotton in it. So it should be removed. Clean the hole. And using one seal material, the hole can be filled or caviton to prevent, to control to a certain degree the odor coming from the implant. The next important thing is checking implant mobility. This should be checked always. If a patient complains about the mobility, if there is only one implant, there is high probability of a screw loosening. In that case, if that is the case, you need to retighten the screw. Otherwise, it means implant failure. It became mobile because of the failure of osseointegration, and it may require another implant placement after explantation. If a patient calls you and complains mobility of implant, that is an emergency. So you need to advise them to come to the office immediately and not to chew on that side. If screw loosening is happening and if the patient chews on it, it will lead to screw fracture. So the patient should be advised not to chew with that. When you check mobility, prosthesis should be removed, and using a device like this, Osseomet, you can check ISO value. If it is over 60, it is determined to be stable. So this is how you check the mobility. Next, when a patient complains, gingiva seems to go down and there is a blackness above the gingiva. It can be gingival recession, so you need to check whether it is really gingival recession or bone resorption. After prosthesis delivery, if it is a case less than a year, it can be normal, but it has been over a year and it has not been any abnormalities during checkups, and gingival recession happened suddenly, you can suspect bone resorption. And you also need to check occlusal trauma, and you need to check smoking or periodontal inflammation in the adjacent teeth. Case, we can do probing with a force not painful to the patient, and we need to check the depth. If the depth is 5 millimeters or longer in the probing depth, or 2 or more bleeding index, and if there is a presence of exudation, we can suspect periimplantitis, which requires intensive control. The probing depth looks quite deep, and on the X-ray, bone resorption is observed. So these are the assessments that we can do. So when we do the probing, if the patient says sometimes they experience bleeding and swelling, so we need to check the bleeding, and during the probing, we need to also check bone resorption. Next, bleeding index. When you do probing, you need to check bleeding, and this is the most important method to diagnose periimplantitis. So when you do probing, you should not apply too much force to cause pain. That is important. If it bleeds during probing, the surrounding soft tissue has inflammation, and you need to check whether it is related to bone resorption. Next, we need to check the presence of appropriate keratinized tissue. If the patient feels painful whenever he or she brushes, that may be due to lack of attached keratinized tissue, or if there is swelling, that can cause the patient to complain about pain during toothbrushing. The patient experiences discomfort when chewing tough food or toothbrushing. Free gingiva grafting can be considered. In the posterior region, 2 millimeter or more keratinized tissue needs to be maintained to maintain implants. 2 millimeter or more keratinized tissue. If it is lacking, as I said before, it can cause pain during toothbrushing or pain during chewing. So if it continues, free gingiva graft can be an option. Next, radiological assessment. This is a basic tool to assess alveolar bone loss after prosthesis of implant is delivered. Up to 1.5 millimeter alveolar bone loss can occur depending on implanted system. If the bone loss continues, and furthermore, if pus is not under control, explantation can be considered. So after setting the completed prosthesis at a time, Panax needs to be taken, and after that, every year, we need to check bone loss by taking Panax for anterior region, or for detailed checking, Apex should be taken every year. And there may be a necessity to explant the implant. Or if there is a 2 millimeters or more bone loss compared to the time of the delivery of prosthesis, we need to check clenching or bruxing habit. If such habit exists, we can consider the use of a night guard like this. Radiological assessment. It is used to diagnose implant fracture. If implant is fractured, the symptoms include implant mobility or fracture, falling off. It can be accompanied with or without pain. And you need to check the mobility first. If it is mobile, the crown should be removed and X-ray should be taken after removing the crown. If abutment remains there when an X-ray is taken, the fracture cannot be accurately assessed. So fracture should be assessed like this. If it is fractured, an implant should be removed using an EFR kit. This is the EFR kit where implant is removed. So let's look at a clinical case in relation to implant maintenance. Number 46 and 7 are missing, and here number 37 was extracted and 3 implants were placed and restored. Post-op 2 years, there is no marginal bone loss at all, and it is very well maintained, but we cannot just pass it. We need to check occlusal situation. SCO, there's an open bite, and during lateral movement, canine guidance is not achieved. That means when lateral force is applied, the force is delivered to the posterior region. So as you saw before, especially when there is an implant in the most posterior region, in a patient like this, it can be exposed to the lateral force. So we need to check occlusion. By adjusting occlusion, you need to check occlusion, SCO, and lateral movement using an articulation paper, and these are the occlusal contacts. Especially in the most posterior tooth, if there is an implant and it is exposed to a lot of lateral force, occlusal adjustment should be made to reduce the lateral force on it. If this is neglected, let's look at the next case, what happens. Prosthesis is completed at number 47 in the ideal position and the direction. After 9 years, it was okay, but at 10 years post-op, the patient complained of pain when chewing with molars, and we looked at it carefully. The osseointegration was broken. That's because of the excessive occlusal force here, which destroyed osseointegration, leading to the removal of an implant. So even though the implant can work for a long time, still maintenance should be carefully done. This shows the importance of implant maintenance. So stringent oral hygiene control and regular checkups should be conducted to avoid excessive occlusal force so that an implant can be used for a long time. That's very critical. Thank you for your attention.